It's our job, it's our duty to try to really kind of engage with the public and be out there raising awareness. We now have trained up hundreds of young people to be young peer educators. What that means really is we're making sure they've got the knowledge, the tools and the skills to go out and to educate their peers around HIV and sexual health awareness.
The idea of having peer educators for sexual health, kind of talking about their experiences and relating it back to how you feel at that certain point in your life, is a really good one, mostly because having someone your own age telling you about their own experience and like telling you how to be safe in that way, I think is a lot more relevant, and I think young people will probably pay heed to it a lot more.
So what we really aim to do is have young people come in like as an older brother or sister sort of figure, and make an environment where the students feel comfortable really opening up and asking questions and having a giggle sometimes, but not feeling too embarrassed about any questions that they might have. One of the main issues facing Australians in relation to sex and sex ed is just making sure that every kid gets a really inclusive education as well, and not sort of assuming that every student is straight and cisgender and all that sort of stuff.
Along with this, you've also got issues surrounding lack of knowledge. So lots of people don't understand what the sort of prevalence of STIs in Australia is. So we've actually got rising rates at the moment, quite dramatically rising. And that is another major issue which really needs to be dealt with.
There are so many people with different views about whether we should or shouldn't be talking to young people about sexual health. And I think the only real answer we can give there is the evidence shows that when you provide young people with comprehensive information from a young age and you incrementally build on that as they're developing and growing and becoming, from children into adolescence and into their young adulthood, that is the best thing you can do if you care about the sexual health and well-being of young people.
I just really wish that there wasn't such a stigma around it, and I think my main message would be that education is the key.